IG live session. We're going to talk about healing digestive diseases today. And so I'll start with when you talk about healing digestive diseases, we all think about stress. It's stress that causes digestive diseases? Let's talk about it a little bit more. So unreasonable deadlines, being stuck in traffic, too much to do, very little time to do it. Most of us are familiar with these daily stressors that keep our heart racing, that quickens our breath, and even makes our stomach churn. Stress has become an order of the day. It dominates subjects, or it dominates conversations on personal, professional, and medical forums. And it is a well-known fact that stress causes many ailments, many diseases. So does it cause stomach ulcers? That's what we're going to talk about. Nada, how are you?
Hello, Mrs. Temvi. Thank you very much. I would like to thank you and express my gratitude for this inspiring introduction and for hosting this very important, critical talk today.
Thank you very much. Thank you. For those of you who are meeting Dr. Nada for the very first time, I'd like to introduce her. Dr. Nada is a scientist and researcher and global speaker in body healing mechanisms. She's an instructor in biochemistry and biotechnology. She's an assistant professor in Department of Pharmaceutical Chemistry in Kuwait University, and she is the CEO of Elxir of Life, Global Consultation Center in Kuwait. So yeah, it's a mouthful, but thank you very much. And it's your accomplishments. Thank you very much again for joining us today.
Thank you very much. My pleasure.
We'll dive straight into our conversation, which you said it's a very important talk today. The subject is very important. So I'd like to ask you that there are, everybody knows what stress is, and it causes long-lasting impacts on our human body. I mean, it can create ailments, as I said. It opens doors to a lot of diseases like heart diseases, even anxiety, depression. It also, reduces our immune system, So what is exactly stress? I'd like to know from you what exactly is stress and how it affects our body.
Thank you very much. What you already mentioned is real. This is scientific. This based on the scientific understanding of stress, which again based on the psychological factors. But this is really needed to be understood now, because many people really talk about this, but there is no real understanding. Even the doctors, when they mention that stress is the issue of, for example, digestive diseases, they don't really, there is no deep understanding of this as science. So when we talk about definition of stress at the body level, it's like the expression of this stress at the hormonal level. Mm-hmm. So to simplify this, if we take example of the chronic stress, we have the acute stress and we have chronic stress. Now, acute stress is healthy. It's important for us to protect ourselves, to protect our body. But the chronic stress is nowadays in the world is considered to be like a disease now. But really we need more research on this just to prove it. But if we understand the stress as a chronic, as what happened during the stress, we will really know the real causes, which is the main causes of all the diseases. So now as acute stress, we can imagine if we see a lion suddenly. And we already have, of course, the stress, as I mentioned, based on the psychological stress means that it is based on what is real in our subconscious mind. So if we just go out from house one day and suddenly we see that lion, we will, based on our program, which was actually in the first 7 years of our age, that lions eat humans. This is already in our subconscious. The mind, we don't even, actually the mind, we don't touch the mind. But the brain is important for the mind. So all the information of the mind already in the brain. In two important areas, we keep talking about them in our message, which is elixir of life. The amygdala, which stores the emotions and memories, and the hippocampus, which stores the information, what we learn in the hippocampus. So based on the information, the hypothalamus in the brain, as when we see that lion, the hypothalamus will give a signal of danger. This is danger. Because if we just leave it, the lion will eat us. So that is the first signal of fight or flight. Fight or flight. It's well known. So what will happen now? The hypothalamus will send signal to the adrenal gland. We have two adrenal glands located above the kidneys. And the adrenal gland has two parts. The medulla, which is inside, the cortex, which is outside. Now what will happen? The medulla going to produce or secrete what is known as epinephrine and norepinephrine. And the cortex going to secrete the cortisol. And if we take the two, there are two different pathways. One through the nerve, and that is the sympathetic, because I need to mention sympathetic is very important, our topic today. The sympathetic nerve is going to send the signal to the medulla to secrete the epinephrine and norepinephrine. However, through the pituitary gland, from the hypothalamus pituitary gland, and it's inside our brain, that pituitary gland, which is the master gland, that's responsible for secretions of all the glands in our body, going to send the signal to the cortex to secrete the cortisol. So first epinephrine, norepinephrine, then cortisol. So we can imagine if we are in the fear situation, you know, we are frightened from something, what will happen? The epinephrine, norepinephrine is going to increase the heart palpitation, the breathing rate, and also it's going to constrict the blood vessels that nourishing the internal viscera. And internal viscera, our organs related to the growth, and that is the digestive system, including stomach, intestine, pancreas, liver. Also the heart is there, the lungs is there. So all these organs related to the growth. So constriction of blood vessel means the blood that is very important to our body, carrying nutrients, oxygen, taking out carbon dioxide and waste products, is going to be directed to pump toward the protective limbs. And that is the arms and the legs.
The legs.
Because they are considered related to protection. So it's directing the nourishing from the growth. Because I need to explain these details in the acute stress, then we can apply it in the chronic stress. So we can imagine how each disease is really related to stress, and that is chronic stress. Now, it will also remember that the limbs, most of the limbs we mean by limbs, the muscle cells. So it's going to react now to this situation, to run away from the lion, for example. Also, the blood here is going to carry the glucose, which will be released from the liver, because the liver stores the glycogen and stored form of glucose in our body, in the liver. So cortisol is going to do that, releasing that glucose. So increasing level of glucose will be carried toward also the protective limbs. Also, as you mentioned, Mrs. Tenvi, the immune system. Even if we have corona, influenza, any disease, not important at this state, because we need to protect our body now. It's not a protection against all these bugs and, you know, the viruses and bacteria. So that's why what will happen? There will be suppression, decrease in the activity of immune system. We mean by that the immune white blood cells. Because we need the energy now to protect ourselves. Because actually the immune system use a lot of energy in our body. So this is actually using the energy for protection against the danger. And then after that, after the lion we disappear, or we run away from the lion and we are safe now, the levels of the hormones will go back to normal. And that's all. This is very healthy. Now, what we mean by our talk today, again, is the chronic stress. It is like the lion is there and is not there. Living in emotions based on thoughts and based on the program. Mainly when we were 7 years old. That's the first program. And based on that program, we can build up our thoughts and emotions. The thoughts is still in these parts, which I already mentioned, the amygdala and hippocampus in the brain, but the emotions still there in the body, stored in the body. So this is very important. Maybe we'll come back to this, because we need to understand what happened when the body doesn't know, when we are inspired by many thoughts and we can't just apply it, because it's like resistance from the body for ages, storing all these emotions when you have a stressful situation. So it's based on thoughts, but also the emotion inside is stored in the body. So this is very important also. So here we can, if we just take each of these, actions by these three important enzymes, epinephrine, norepinephrine, and cortisol, or adrenaline, noradrenaline, and cortisol, these are other names, we can really understand the real cause of each disease, including heart diseases, cancers, because cancers are different diseases, and also the respiratory diseases, the decrease in the suppression of immunity, rheumatoid, digestive diseases, ulcers, all these diseases related to chronic stress.
Okay. You just mentioned about ulcers, doctor. Can we go a little bit more and understand what ulcers are exactly?
Yeah, thank you very much. Actually, including ulcers, there are other digestive diseases, just to mention them, but mainly I take this tonight. I would like to focus on ulcer just to take it an example of these, diseases. These diseases include the irritable bowel syndrome, small intestinal bacterial overgrowth, gastroesophageal reflux disease, gallstones, also Crohn's disease, and ulcerative colitis. Now, ulcers, one of these common diseases, it is actually, by any simple definition, it is open sores, on skin or mucous membrane. And sore could be also, it's not only in the ulcer, just as a general term, not only in the stomach and intestine, it can range actually from small painful sore in the mouth to serious lesions or damaged tissues in the stomach or intestine. So this is simple definition, yes.
All right. So, when I was researching about this topic, I was, I read something, and I'll quote here. I read from the American Psychological Association. It said that, contrary to popular belief, stress does not increase acid production in the stomach, nor it causes ulcers. The latter are actually caused by bacterial infection. When stressed, ulcers may be more bothersome. What do you think about that, doctor?
Yeah, thank you very much. So inspiring. Actually, the bacterial infection, this is one of the common causes. This is real. But we know when they just talk about this, there is not enough research to prove this. But if just the common sense, when you understand it and you go and ask the people who really, the patients about this, you will see they are already stressed and they carry out being stressed, taking the treatment. But they are still in the treatment and they are not healed. So we need to search in this. This is very important. Number two, no, this is the thought because I think this is real. The chronic stress is responsible for the digestive disease, responsible for the incidence of ulcers. And because there is no real understanding and deep understanding, this is also for the scientists, very important. Even the psychologists, real and deep understanding of stress itself. Even people, they do many stressful things. We need now in this era of the human development to really understand the meaning of stress. Even how do we behave actually and deal with children or even deal with animals. Because it's just normal in our life, you know, being in stressful and being just, having all these ideas that we can transfer from one generation, we transferred all this from one generation to another, is like just normal thing, normal life. And actually people, how they define, as you gave in the first introduction, which I really love it, the stress means to the people's like being in chaos, being like distracted with many things.
Yes.
That's the understanding of the stress.
We don't understand stress, as you said. You know,
Yes.
we feel that stress is like a normal thing, but it's not. You know,
It's not.
It's not. Yeah.
Even the incidence of diabetes here in Kuwait, for example, or even the Gulf, you know, when people they age, they have normally for them to have diabetes and high blood pressure. And this is not normal to them. Oh, this is normal to have all, you know, this is aging. It's normal to be. And they don't understand actually the meaning of aging. When you have it's like being older is different than aging. Aging means that you get, you know, biological aging means when people, they get all diseases. It's not necessary. Many people really, but they are less. They are like maybe 90 years old, but they still healthy because they are happy.
Yeah.
Yeah.
Yes, true. So going back to the ulcers, doctor, what are the common causes of ulcers?
Yeah. As you already mentioned, number one, the infection, and that is by bacteria called Helicobacter pylori. And this is actually one of the main causes. Maybe people, they get this bacteria through food or even the water. These are some of the common causes which I'm going to mention. Okay. Also, consuming the anti-inflammatory drugs like paracetamol. Some people, they are addictive on the painkillers. Paracetamol, ibuprofen, for example. They can be irritable and cause inflammation of the lining of the stomach. If they keep regularly consuming these drugs. Also, family history. Family history, the genes also involved, could be related to the incidence of ulcer. One of the important also behavior is the behaviors related to ulcers, the high caffeine intake. Some people, they are addictive on caffeine, drinking coffee. And that is because the caffeine increase the production of stomach acidity in the stomach. You know, the stomach itself, now if we focus on the ulcer in the stomach has to be acidic. This is normal. The inside of the stomach is acidic. And this is well-known information because this is needed by an enzyme called pepsin. And pepsin is involved in the digestion of protein, digestion of meat, chicken, proteins. So to be, the normal stomach has to be acidic inside. So taking caffeine may increase the acidity of the stomach. So these are 4 of the main causes or common causes of the ulcer in the stomach.
So we're talking about common causes. Are there any real causes as well?
Yeah, of course. You know, if you dig into this and you really, and you have the passion, you know, and the interest to dig into it and you understand how this happened, it's like go back. Now we need to go back to the real reason or reasons, and then we can connect with these common cases, reasons why they happened. This is deeper.
Yeah, let's see. Okay. Let's go deep. Yes.
If we go back to definition of the ulcer in the stomach, it is a sore in the lining of the stomach. And what happened actually, and let's connect it now to the actual, the chronic stress. Continual, you know, the chronic stress based on emotion, that is negative emotion, okay? And there are different negative emotions. And living this, keep, you know, repeating the same thoughts and ruminating the same feeling, and you feel it in your body, and you can first feel inside your stomach the butterfly sensation when you live this state. you know, this emotional state. Okay? So what happened actually, again, constriction of blood and accumulative effect of this. It's not one time, it's just people, they keep doing this. It's like a habit now. It's like the body got used to it, the emotion. Now being addictive on the emotion itself. And the accumulation of this emotion and secretion of these hormones, again, epinephrine, non-epinephrine, cortisol, and feeling this as normal will result in constriction of blood vessels, redirecting and pumping the blood from the stomach to the protective limbs. Again, the blood is very important, having this nutrients and oxygen. So there is no enough nourishing for the stomach. Means what? There is no enough nutrients to help to build up the mucus or the mucosal membrane. And why we need this mucosal membrane? Because we want to protect the inside of the stomach from the acidity. So there is no protection against this acidity inside the stomach because there is no mucosal membrane. This will result in what? In the sores in the lining of the stomach. Okay. This is the real cause. And it happens like you live in this situation and then results in ulcers. Now, doctors know about this. When the patient, they just from diagnosis, they would diagnose as having this ulcer. They say, oh, you are maybe stressful, see your environment, what's going on, you need to take rest. But there is no real understanding what's going on exactly. Now, if we go back now to the common causes. Number one, infection. Infection means there is no enough, the immunity is not active enough.
Yes.
To deal and balance, I always mention balance because we need to neutralize. It's like high immunity is there, the bacteria is there, we need to neutralize that bacteria. So this is number one. Number two, we have the taken, of course, the painkillers. Again, there is something wrong. Why there is pain in the body? What's going on? Again, there is also stress. So we keep in we are the same circle again. Number three, the family history, the genes. Now everybody's talking, the people now, the Middle East is different, but people now, scientists in the world, talk about epigenetics. Maybe the gene is there, but it's in our hand to control, you know, switching on or switching off the activation of the gene. It's not necessary to be active, even if it's there. So that is like people, maybe there is people, I think. People, they carry many genes and could be associated with different diseases, but not necessary to be affected by this. Activated. Thank you. Yes. Okay.
True.
Number
yes.
4, now I just mentioned the last behavior, which is drinking coffee, being addictive to coffee.
Yes.
Being not understanding and listening to your body, because many people, they can't, like many people, they can't eat spicy food.
Yes.
Or many people, they can't drink too much coffee. So this is the body again. You can't listen to your body unless you are at the level to be conscious enough, you know, I mean spiritually conscious. You have a spiritual consciousness. Then you can listen to your body. And having this behavior, being addictive in general on anything, means that there is a stress again.
So you now talked about the connection between the real causes and the common causes that we discussed right now. Now let's go into another kind of connection, like what we say about our gut and our brain. We always say the gut is the second brain. You know, there is always a saying something like that. So what is the connection between our brain and our gut?
This is actually a new area. Scientists still searching this area. There is a direct connection between the brain and the gut. And that is through access. It's like big. It's like different, you know, pathways, connecting pathways. So the first one is by the nerves again, because we have two groups of autonomic, you know, nervous system, which you can't control it. You can't control your heart beats, by the way. You can't control the digestive, you know, motility, for example. So again, what we talk about is sympathetic and parasympathetic. Sympathetic, if we talk about the sympathetic nervous system, actually these are nerves originated from the spinal cord toward different organs. So this is, I consider this as the first connection. So that connection to the stomach. Sympathetic is related to fight or flight. Maybe I repeat this. Sympathetic is connected to fight or flight, responsible for this action or response. The parasympathetic is meant by rest and digest. That is here very important, rest and digest. So this is again, sympathetic or parasympathetic nervous system, also nerves, different group of nerves, originate from spinal cord, okay, and also the skull, to the same organs. So it's like having the two wires, having the two nerves connected to the stomach. One is activating and the other is relaxing. And again, usually what happens, the stomach, when there is a response or the fight or flight response, what happens, there is no digestion, we know. Digestion is related to parasympathetic. So like inhibiting, you know, the digestion by sympathetic and carrying out the digestion by parasympathetic. So this is the first connection to the central nervous system, the brain. Number two, we have also the enteric nervous system, and this is well known now. The enteric nervous system, again, is considered to be a direct connection between the brain and the GI or the stomach, and that is through what is known as the neurons, the nerve cells. It's like mesh-like neurons connecting the two. Actually, here the brain is, you know, controlling the function of the GI. So we can imagine when we have all these, you know, negative thoughts and having this emotion, how actually we can upset without knowing that.
Yeah. But there are cases, doctor, that, you know, when you go through certain stressors in life, maybe instead of shutting down or not having that hunger, you tend to eat more.
Yeah, but that's because, thank you. Yes, yes. So.
Yeah, why is that? I mean, why is that somebody? I'm one of them. I'm a stress eater, I think. Whenever something is happening, I need to eat. Yes.
Yeah. That is after maybe you feel that stress, and you, because of the stress, you feel that you want to eat because you want to relieve the stress. That is psychological again, because you want to relieve it, to soothe it, to feel good. So that's why people, they are addictive on food, chocolate, and maybe they'll do other activity, could be lower value, could be something pleasure, they go choose to it. So this is important. So I need to mention here the vagus nerve, very important, because
that's the number
science,
3.
That is number 3. The vagus nerve is very important. It is related to parasympathetic nervous system. It is the longest nerve in the body. It originates from a skull. And actually, there are many researchers now talking about treating diseases using that, by activating that nerve. Actually, when we do the breathing, the conscious breathing, we are actually activating the vagus nerve. That's why we feel good. Yeah. Also, I would like to mention, very important.
Yes.
And this is a new area here, the gut microflora.
And what is that?
It's well known. That is the gut microflora. We know that there is good bacteria living in our intestine.
Yes.
Involved in the metabolism of food, very important, and also synthesis of some vitamins, like vitamin K. Okay. So some people, they don't have healthy microflora.
Okay.
They have problems in digestion. So that's why some, many like people involved in health, they talk about probiotic, kind of food like yogurt.
Yogurt.
So this is
Yes.
to help to activate these microflora. So to have good digestion. And there is communication. They also discovered that the brain also affecting the microflora. That's why also some of successful people, they have problems in the microflora. That's why they have problems in digestion.
Okay.
So I would consider also this is the fourth connection.
Okay.
Yeah.
All right. So when we were talking about, about these connections, when we talk about a human body, you said that subconsciously, we were talking about subconsciously, we activate things. For example, if somebody has gone through a major life stressor in the early part of their lives, after that, they might not have that kind of stress. But can that, which has already happened in the past, affect their future, digestion?
This is an amazing question. Thank you for that question. It's very important. Here, mostly we talk about the nurture. It's very important our life. Actually, what we do now, most people do in their life and their lifestyle, mostly based on their nurture, how they were raised. And what really happened, this is the main responsibility of the parents. It's like programming and establishment of the healthy mind. Because the healthy mind results in healthy body. And we mean here healthy, which is, I don't mean, if I say healthy, it's not wrong or right, this is different, because this is the perception again. What I see it right, maybe you'll see it wrong. But healthy means healthy mind that is willing to take over. And that is very important message for the next generation, for parents. So we'll have healthy generation, take over in what they love to do, their purpose in life. So here, like now we are approaching to the real cause of chronic stress. Maybe people wonder now, what's the real cause of this chronic stress? Even if they avoid, they will say, oh, I'm not stressed, but still they have the stressful environment. They have the stress inside, and there is no coherence between heart and brain. Because if there is coherence between heart and brain and mind in the middle, mind is the bridge, then they will have a healthy digestive system. This is important because they don't have chronic stress. So yes, what happened in our life, especially in the first, 7 years until 12 years, very important because it is involved in the establishment and programming our mind. So the program, because there should be program, no way. Because subconscious mind is there. We act according to the subconscious mind. That's why people, when are inspired by many, many things, they can't apply because that's the body. And to get to the body, to act, for the body to act, the information has to transferred from the conscious mind to the subconscious mind, because subconscious mind is actually controlling our movement. So understanding this is very important. They need, number one, the way we are raising our children to have a healthy generation. Number one, they should have no obstacles, okay, that they will prevent them from playing their role in life. The built-in message, the built-in highest value. Number two, understanding mind is very important. Understanding the universal law of having negative and positive is very important. This is critical, important. I promise, I'm sure, even the audience, if they just dig into their life, whatever negative, they see it negative now as an event of persons or anything happened to their lives, there should be a positive side. Because this is the law which actually controlled, actually this is the base of the creation. Okay, so nothing is a pure negative, nothing's pure positive. But also, this is depends on the consciousness. So this is the role of the, the parents. Very important. They need to understand it, and of course, they will give it to their children. So to have healthy generation, inspired, understanding, and really conscious about their role in life and purpose in life. So that's when people keep talking about purpose in life. It's in their heart. And this is supposed to be, and I'm sure, this is my belief, it will be part of our education, the future, in the schools. It will be just some, normal. Like you say, when we say, what's your job, what's your hobby? No, the best way to say it, what's your highest value? What's the hobby of your hobbies? And priority of your priorities. So that's the thing. This is very important. So there should be the future in the schools. It will be just some, normal. Like you say, when we say, what's your job? What's your hobby? No, the best way to say it, what's your highest value? What's the hobby of your hobbies? And priority of your priorities. So that's the thing. This is very important. So there should be the base, the mind, to start to act in life based on the highest value.
Okay. When I was introducing this topic, I was talking about what ulcer is, which we covered. What ulcer is, what are the common causes and the real causes of ulcers. Let's go to the healing of them. How can we heal them?
Yes, thank you very much. Now, maybe I need to clarify this first. Number one, chronic stress based on not discovering and not being conscious and understanding the highest value.
Okay.
People that are living away from highest value, in survival state. They need to go back to the living state, going back to listen to their hearts. And start to understand it by mind, so they can change the mind, and the mind will give orders to the brain. So the brain, it's like the neural plasticity, because there is change in the neural pathway. This is real. We can change it. Some people, they say we can't quit from smoking. No, you can. Because we need to control our minds, not the mind controlling us. No. We need to act, we need to control the mind, so it will be like a servant for the body. So giving the order, from the heart, it starts from the heart. So heart number one, that is the soul inside there. That is the priority in life, the highest value. And then the mind understand it. And then based on this, the information about ourselves will change. That we are amazing. We are all amazing, but we need to listen and discover the key. And have the good effect in life that will be remain there after we leave the life as a body. So this is number one, the secret. Number one, discovering the highest value. Healing from cancer. Healing from cancer means balancing the cause of cancer, the causes of cancer. I would say causes because I think there are two main causes. Number one, the highest value, having the strategy which we need to achieve in 10 years, for example, from now. And that is number two, the mind. Because we are still now the era at which we have, maybe we got like negative way of having all these negative thoughts and behavior since we were young. So we need to balance this. We need to forgive ourselves and our parents and whoever we think caused pain for us. If you look at the other side, we won't move until we have challenge. The challenge, most of challenges in life, drive people toward what they love to do,
It's an
And
opportunity. It's an
opportunity.
opportunity.
Thank you very much. Yes. So
Yeah.
that is the number one. So healing starts from the heart, and then cohering the heart with the brain. So there will be no fight or flight in the brain. That's the secret. No fight or flight in the brain, no action, no response to any danger, because we feel balance inside. We feel happy and inspired and involved, really engaged and really busy in what we love to do. That's the secret, because you don't have, you would consider whatever is was, oh, it's like worrying you and causing this anxiety. It's not important now, because you understand it, because you understood your highest value, and also you understood mine, so you will understand the values and what happened actually in these, difficult situations or stressful situations, which mainly based everything in life, Mrs. Tanvi, based on value or benefit.
We're talking about, like, as I said, we're talking about healing, right? So when we talk about healing, is it healing different from treatment?
Yes, thank you. Huge difference. Number one, treatment is body. And treatment is important. Whoever now from the audience has ulcer, it's very important. Take the treatment, because treatment is a value also. People maybe delivered, scientists delivered good medicines, but I mean by that, this talk is not to keep, you live on these medicines your whole life. You will keep living in this stressful life, not inspired, and you will keep take this medicine. So it's like, you are actually destroying your body. So the thing is to take the medicine, start to work on healing, which is balancing the cause of disease. Treatment different. Now healing, you need to start to balance the cause of the disease. So once you do that, gradually, I'm sure, I promise, the doctor will tell you to leave the medicine, because you are good now. You are healed. And maybe some doctors, they just amazed with the results. I think this is true, and I think we are moving toward higher development of humans.
True. I have a very nice comment. Says that Imam Ali, peace be upon him, he said that your medicine is in your food. Thank you for sharing. Thank you for sharing
Wow.
that.
Very
beautifully,
nice.
beautifully said that.
Yeah.
Yeah.
Thank you very much. I highly appreciate this message, because, I believe in food. I believe in medicines. I believe in, medicinal plants. I believe in, healing by energy. All these kind of different treatments.
So basically, we're saying don't put yourself that you should not get yourself treated. If you need to get treated if it requires, but you need to go to the core of it and start healing yourself from there.
Yeah, even this include the balanced food or the food that used for treatment from ulcer. But maybe, yes.
Yeah, no, go ahead, please. Go ahead.
Yeah, but yes, you need also at the same time to carry out start the healing. Yes.
Yeah. So, I mean, like we said about balanced food here, balanced food, exercise, maybe eating right, stress management. These are all ways that, when you go through the internet, this is all the ways that you have to do to get a good GI health. But what apart from this we can do to get a good gut health? Apart from this.
Number one, stress management. You mentioned it already. So they just mentioned this as the common cause or common principles of getting the healthy digestive system. But number one is the stress, to have a balanced mind. And then you can go toward, the other, the lifestyle, the healthy, the well-known healthy lifestyle, the balanced food, practice.
Exercise.
This is very important. Exercise is critical, because it is very, it's like program for years now that people need. They have to do exercise so they will be healthy and even relieve the stress. They don't know different. This is different, because if you want to relieve the stress, you go and do what you love to do. you practice, you do exercise like 2 or 3 times a week, and you understand why you do it, unless it is a highest value. Exercise and sports, your highest value, that's different. So we need to really distinguish and understand and have this hierarchy of understanding the value, which is the highest value, and then how you want to really arrange and, you know, organize your time based on this. This is number one. This is healthy lifestyle. And then you go to material, food, exercise, all this. Because number one is the spirit, the soul. And then whatever is lower is material. Body. Thank you very much.
Body. Yes.
Yes.
Okay, so you say that when we have our value, we discover our value, we understand our value, we create a coherence between our mind and our heart that balances our soul, balances our body, that heals us from inside. So any ailment that we have, either like what we are discussing about ulcers, any GI disorders, any ailments can be healed if you know and practice your highest value.
Yes. Just a slight addition regarding the parasympathetic nervous system, because, you know, actually I'm interested, I actually love this, you know, autonomic nervous system. It's involved in real healing by balancing the internal, you know, environment in the body. And also it will activate the deep sleep. This is important, because to be healed from a body, you need to sleep well. And most people, they don't sleep very well because they suffer from anxiety. Even if they sleep again, they would have nightmares, and also increase in the cortisol, or the cortisol itself has inverse relationship with melatonin. Cortisol related to stress, melatonin is the sleep hormone. They have the inverse relationship, means if there's increase in cortisol because people suffer from anxiety, there is a decrease in melatonin. That's why most people, they don't sleep well. It's like they are waiting for the lion. They feel the danger. You know, when you are in, you know, camping in the wood, for example, you don't feel very safe.
Yeah.
So it's better for you to be awake, just in case if there is
something happens. Yeah.
Something happen.
Yes.
So it's like you are on fight or flight. So there is increase in cortisol. So most people, they live in this state. So that's why they don't sleep, regardless the number of hours. I'm talking about the quality rather than quantity.
Quantity.
Yeah.
Yeah. Yeah.
So I would like to invite everybody to discover the highest value and to balance the mind and enjoy the life, and also to be inspired and happy.
Exactly. I have covered a lot of topics in my previous talks with Dr. Muhammad, where we talked about our minds, we talked about survival and living, understanding our value or finding our value with Mr. Ahmad. All these are available already on my Instagram, on my YouTube channel. So if there is anyone who'd like to go back and listen to what we are talking about value, what it is exactly, and about understanding the mind, then you know exactly what we are talking about at this point in time. So again, Dr. Nada, it was such a pleasure to have this discussion with you, and I'm sure we'll meet again next month, and we'll pick up a very interesting topic again, which will challenge me as well, because this really challenged me to understand and to know and research about this topic. So thank you very much for giving me this opportunity to have this conversation and dive into my my own value, which I am in the process of discovering. Wow. So thank you very much, and let's all be happy.
Let's all be happy, and I highly appreciating hosting this important interview. Thank you very much. Thank you from my heart. Thank you.
Thank you. Thank you very much. Good night.
Good night. Bye.
Good night. Bye-bye.
Bye-bye.